my task is today to talk on use of artificial intelligence to reduce cardiovascular morbidity and mortality in India. We heard an outstanding talk from Dr. Venkat. The need for a large database where diabetes, obesity, and heart disease can be put into a larger scale. My question always is, we do have the data. We do know in India we have high incidence of diabetes, cardiovascular disease, heart attacks. But how do we reduce that mortality, morbidity? Just giving me the numbers is not enough. So I'm also in the process of studying AI and integrating it into cardiovascular medicine. Mostly AI utilizes the mathematical algorithms that gives an ability to reason, perform the cognitive function as problem solving, object and word recognition, and decision making. Mainly, it involves 2 or 3 steps. One of them is machine learning, deep learning, natural language processing, cognitive computing, and computer vision and robotics. So broadly, AI can be divided into one learning process, and the other one is where it can be of artificial help, such as robotic use. So AI in the daily life versus medicine, we all know in the daily life applications such as self-driving cars from Tesla to voice recognition speech from Amazon, such as Alexa, has been helpful. Similarly, in medicine, IBM Watson has been helpful in monitoring patients' blood pressure, trying to give a trigger to the doctor when the weight goes up so that I don't need to see the patient. We can alert by the increase in the weight that the patient documents, and I can give an extra water pill to help in treating heart failure. That's just a simple example of use of AI. The rate of adoption of AI in medicine is always slow because compared to the other industries such as financial technology, information, and aerospace, because we need repetitive data, we need proof of concept. We also need to pay into consideration the stakeholders such as the insurance company, the hospitals, and also we need replicability, and is it causing a bias in the way we treat? Because as Dr. Venkat was saying in the previous lecture, if you notice, he was bringing up a Framingham study, which is a large-scale database up in Northern England about 25 years ago. It was published. We still continue to blindly follow. The patient subset is different. How can we adapt AI to the old database? We need to have something that's very unique to Southeast Asia. We are nowhere close to what the Caucasian population is or the African-American population is. So we need our own database. We need to apply the AI to our database and not just interpolate what the results have come out from the previous studies. So in terms of the AI use, the 3 main modalities that for me fascinates is supervised learning, unsupervised learning, and reinforcement. Basically, supervised learning, what it does is helps you to label the data clearly and predict the outcome, something like a classification of mortality. How can we classify the diagnostics? How can we reduce mortality of the patients for simple problems like heart failure? In terms of the unsupervised learning, machine understands the data and input output are known. You can kind of classify the diseases, whether it's retinopathy or nephropathy or segmentation of a large disease into a smaller database. In terms of reinforcement learning, machine learns to act in certain environment and basically reward the learning process with a negative feedback. So for example, if you were using a robot for navigation, if it's making mistakes in the way we move the arm and it's going to cause harm, you can have a negative feedback to prevent the arm from moving before it makes an erratic cut or something. So AI is all about set of algorithms to use the machine learning, deep learning, and NLP, which is the natural language processing. That, along with the cognitive computing and the computer vision, can help in putting things together where remotely you can help the people even as far as India without being present there. I think one of the robotics that's been used for interventions in India is up in Northeast in the Gujarat area, where one of the first cases of heart intervention was performed using robotic. But in a big country like India, we need it to be in a more granular scale, rather than just one place where this technology is available. So the key concepts in cardiovascular disease with the machine learning is to identify the features of the data, perform a predictive tool for algorithms, and understand the pattern from a large heterogeneous database. Basically, can it provide a superior and a robust prediction? One of the studies from Azalani showed that if you're going to do heart cath procedures like a coronary angiography, depending on the patient subset, like does the patient have diabetes, does the patient have chronic kidney disease, does he take any pain medications, can we predict the patient who is going to get a kidney damage and who's going to end up on dialysis? So deep learning is workings inspired by the human brain, mainly the algorithms of the neural networks and how interaction can help. For example, is there applications to predict the different modalities of angiography, CT, and MRI, wherein they can automatically interpret. For example, Oxford this year formed $1 billion company where the echocardiography for stress tests can be interpreted without a physician more accurately than what humans can predict. However, this is based on algorithms and repetitive measurements of the numbers that we see on an echocardiogram. In terms of supervised learning itself, these are data sets that are collected as specific labels, and you can predict a future events or a variable relevant outcomes. So when you see an angiogram, that means when somebody injects a dye into the coronary arteries, for my naked eye, it may appear to be a coronary tear or a blood clot, but the machine may be able to look at more detail and be able to give a better diagnosis of a tear and a blood clot because the treatment of these two can change. Similarly, can a model predict about the heart failure readmission accurately and grade a heart valve leak? Because when we grade the leaks, we may call it mild, moderate, severe. But in truth, what is mild, what is moderate is to the eye of the beholder each time. So if we have a machine to predict the models, we may be able to improve the heart failure readmission and reduce the hospital mortality. In terms of the unsupervised learning, basically, we have large databases which we may present with the phenotypes of the data, like how Venkat was talking, but can we discriminate enlarged hearts in the athletes? And again, classification of an heart failure between the ones with a preserved left ventricular function and the ones which do not have. Where else can AI help? AI can help in robotic assisted procedures, remote assisted procedures, either voice assisted or augmented reality, clinical decision support. One of the best places it can help is a virtual televisit during the COVID pandemic, where a second opinion can be obtained anywhere from the world. You don't need to travel. So these are some of the examples where a robot can help in performing a procedures, but we don't need to be present when even far away from thousands of miles by a voice-assisted control or augmented reality, we can help and can help in making a clinical decision-making where there is doubt about a disease process, we could help from far. And an augmented reality with a holographic display of the procedural guidelines. If you see the physician is not even touching, through the hologram is directing the robot to do the procedure. So AI for the cardiology procedures, whether it's the tele-intervention, robotic assistant, microbot, or the interventional training simulator, or a cardiovascular robotic platform, all of them have an interaction. In terms of advantages and disadvantages, the precision of accuracy is the advantage. Procedural assistance is of importance, decreases the inter and intra-observer variabilities, and time-consuming administrative process can be cut down. The challenges are it's complex and the cost. There's a lack of human touch. Can the robot do all the procedure without a human being? Probably not. There's something about a privacy that we need to worry about the patients. And this training data set has to be integrated to that particular place. What I mean by that is Indian subset of patients are different from the Caucasian population or the rest of it. Then the regulation, legal and liability issues. And also there's always a threat to the human job. Will AI replace some of our jobs? In conclusion, AI has initiated a paradigm in the shift of healthcare. It's powered by an increase in availability of healthcare data and rapid evolution of the analytical techniques. It's expanding into intra-procedural video analysis, evidence-based and real-time clinical support. AI in synergistic interaction between man and a machine can ultimately transform cardiovascular practice and improve clinical care. I'll end my talk here.